Hello, and welcome to the 11th episode of our Strasz Assessment Systems podcast, Beyond the Test, Strasz Talks. I'm really excited to have a long-term colleague of mine in the testing industry, Bill Seifarth, with me this morning. And Bill is the CEO of NREMT. And Bill, welcome to the podcast. Thanks so much for joining.
Rory, it's great to be with you, and certainly I'm looking forward to our conversation. Thanks for having me.
So, Bill, tell me a little bit about who you are and your role at NREMT.
Sure. So, in short, I've been at the National Registry of EMTs for, I believe it's over 6 years now, going on 6.5 years. My background is in EMS. I am actually a paramedic, and I worked in the state of Maryland's state EMS office, overseeing EMS education, and so I really started to have a liking for testing in the certification industry, and then from there I continued in EMS and was at Intelios, another nonprofit certification organization, for a few years, and then this position came open here. So that's how I got here, and passion for testing and certification for sure.
So, Bill, I'm curious, how is it blending those two sides of both being, a subject matter expert in your case, having practiced in the field, as well as, I know you spent several years at Intelios, so you certainly have a decent amount of testing background. How has that been, kind of combining those two perspectives in your role?
Well, actually, it's been ideal because, I think, as I always describe myself, my ideal job involves both EMS, emergency medical services, as well as testing and certification, as I love it. That's my likes and passions in life, and I'm blessed to have an opportunity to lead the nation's EMS certification organization at NREMT, combining two of my passions into one job.
I love it. No, it's a fantastic blend, and I know certainly is appreciated by your community, who can see a fellow colleague in that role. Well, that said, now for those who are unaware, what is NREMT? Tell me more about the organization, and particularly how it's evolved in your 6 years as CEO.
Sure. So a little bit about the organization, then I'll get into how we've evolved. It was founded in 1970. The Johnson administration had realized a need to have better uniformity and standardization, certainly with the training, but also with the assessment of competency of EMTs and paramedics. So we are a nonprofit 501c3. We are headquartered in Columbus, Ohio. And although we are a virtual organization, we do have a building here in the middle of Ohio. So in terms of how our organization has evolved the last few years, I view the first 5 years of this organization, my tenure here, as a lot of transformation. We've transformed our organization to be a stronger, and I think a more focused on certification elements and competency that serves the EMS profession. When I got here, there was the notion that we were an EMS organization that does testing. I kind of flipped that on its head, and I said, we're first and foremost a certification organization that serves the EMS community. And what that kind of identity shift has caused is for us to really enhance the robustness of our testing, of our examination and measurement of competency. And we have improved our examinations, which we'll talk about. We've had a better focus on what's called continued competence, so assurance of competency after the initial testing. And we've also undergone a significant overhaul of our IT because although we're not a technology shop, we're enabled by technology. Honestly, we're dependent on it. So those are the things that have evolved, and we've had an initiative that's ending this year. It's called Strengthening the Core. And that strengthening the core is overhauling our IT, improving our exams, rethinking how we measure continued competence. And as a result, we've really transformed the organization to what it is today.
Well, that's a lot to be done within 6 years. So I commend you for the ability to create all of that transformational change in what is not all that long of a time period, if we're being honest. So let's jump directly to that evolution in competency. I mean, NREMT, you just said it well, is really cemented in that assessment of competence of EMTs who do serve the public in so many different roles. And indeed, yes, this year you rolled out a major change. I know that's been multiple years in the works by eliminating the psychomotor exams, launching this new framework. So yeah, would love for you to share with me, kind of how did the project come about, and what evolution in the practice really provoked all these changes, as well as how it's gone since you're a bit in now.
Yeah, I'll answer the last question first. How it's going? It's going well. It's going as we planned and as we anticipated. And so, what is the it? It's a redesign of two of our four programs. How we assess competency for advanced EMTs and paramedics. There are two highest levels that have received the most education. And being followers of the exam development cycle, of course, you have to start with a practice analysis. And our practice analysis that was done in 2019 and subsequently updated in 2021 revealed this concept of clinical judgment and the importance that it plays, especially with an advanced EMT and a paramedic and their role in day-to-day activities as what they do. So what that translated into is we need to better assess clinical judgment. And so we developed a model to assess that. We subsequently developed items that were testing clinical judgment, which essentially what we're doing is we're working through an entire scene that a paramedic or an advanced EMT would encounter from when they're en route to an emergency situation, when they're on scene, and then post scene. So they're the three kind of phases. In each of those phases, we have a series of questions with a variety of item types that are asking clinical judgment type questions. So are they able to get information, process that information, have a plan of action in terms of the treatment, and then reassess and see how it's going. So we've incorporated clinical judgment into a little over 1/3 of the exam for advanced EMTs and paramedics. And we started pre-testing these item types back as far as October of 2022. And we continue to pre-test those on our exams today. But on July 1, we launched the examination, and there was a lot of anticipation, a lot of anxiety by some people, especially in the profession, because there's this thing called change, and we changed the way in which we assess. So we actually improved the way we assessed it. Now, with the incorporation of clinical judgment items, we also discontinued our psychomotor examination for advanced EMT and paramedic. And there's a variety of reasons why we did that, but we replaced the psychomotor exam with a document referred to as student minimum competencies. So during the education, it's akin to a portfolio, but during the education experience, the students and then subsequently the candidates for our examination have to have so many patient encounters and so many skills. For example, so many geriatric, pediatric, trauma patients, cardiac patients, respiratory patients, and then so many skills that they have to do as well and demonstrate competency over time. So essentially, this new student minimum competencies or portfolio is the amalgamation of evidence over time to show the progression of proficiency and competency with skills, rather than a one and done event, which is what our psychomotor exam did. So we have a much stronger case as far as our assessment, the comprehensive assessment of candidates. And we take that very seriously. As part of our mission is to have lifelong assessment of clinical competence, because unlike with a physician or a dermatologist, a pediatrician, an attorney, you can go online and see the reviews of that physician or that attorney. When you call 911, you don't get to choose the paramedic that's showing up your front door. So our mission is vitally important, and we are used in all 50 states. Our certification is required as a prerequisite for a licensure in 48 of those states, and about 20 states require maintenance of national certification, where they have to maintain their national certification with us. So as the nation's EMS certification organization, this transformation and this evolution in our exam is a definite redesign and an absolute improvement in how we're assessing competency and ultimately doing our mission.
I love hearing about, in particular, with where you've taken the holistic element of assessment. To your point, especially as we talk about competency in assessment, we do focus a lot, of course, on that test. But the more that conversation becomes goes more in depth, the more that we look at indeed holistic assessment over the course of time. And so I love that you guys are including that, really as part of this battery. You mentioned change, and of course, I don't think any of us have seen a major exam change where there's not been ample trepidation. But that said, I'm sure some of that dust is settled. What has been the feedback from your community, from the practitioners? Do they see that same alignment between where you all are trying to go with a better attesting to their skills and how this matches up with that end goal?
The reaction was a bit surprising to me. I mean, we knew how the items were going to perform because we pre-testing them for a couple of years. But what was surprising was the candidates that take the exam come out and say it's very realistic. They like it because of those clinical judgment scenarios that are included. They feel that it is a fair test, which is important, obviously, in our business, and they think that it's realistic. It's realistic to the kind of calls that they're encountering. Contrast that with, I wasn't saying that our examination was not proper prior to then, but we had a lot of, each item was a different type of knowledge that we were testing. And then we used our psychomotor examination to kind of, I'll say, artificially assess clinical judgment. But now we can do clinical judgment, I think, in a more precise way, a more psychometrically sound way, and in a fair way than we did with the psychomotor exam. But the reactions have been very favorable from instructors who have taken our exam, also that they're required to maintain clinical competence. They love it. And it is an adaptive exam too. So there's that nature with it. So it's a precise exam. It's better. It's very well liked, and it's performing quite well.
So you mentioned, along with this change to the certifying exam, the new competency framework for continuing certification, and of course that launch as well. Please, if you could tell me a little bit more about what you've done with the NCCP and again, how you see that contributing to your mission within protecting the public.
Yeah, and I'll start with the mission. As I said, part of it is to have lifelong assessment of clinical competence. So at the beginning, it's easy to measure that with the test. Throughout the career, though, medicine is such, pre-hospital medicine particularly, is very dynamic, and it's ever changing. So there's a need for certainly continuing education and a role for continuing education. But what we are thinking differently about is how can we better ensure continued competency that is perhaps simpler and more meaningful, and certainly as part of that more meaningful, more relevant. The relevant part obviously related to the evidence-based guidelines. The simpler, more meaningful is the incorporation of evidence-based guidelines within education, within other opportunities for assurance of continued competency beyond that initial assessment. So we've incorporated evidence-based guidelines. We are soon to be publishing an agenda document, a visionary document, on how we as a profession, broadly speaking, EMS profession, can think differently about how we ensure continued competency and give credit for evidence that shows continued competency of the EMS clinician. So it's an exciting new chapter where we're going to be focusing on this between now and 2030 in EMS. So it's going to be a long time. And part of that is this NCCP, which again is simpler, it's more meaningful, more relevant, and it's the National Continued Competency Program, is what NCCP stands for. I should have defined that earlier, but it's looking to be promising. We're going to be incorporating some not before used assessments as part of clinical competence and continued competence, and we're looking forward to it. It's a new chapter coming for the National Registry.
Oh, it sounds like we've opened a couple new chapters here with you, to say the least. Now, curious, Bill, just, you mentioned the vast majority, almost all of the states accepting the examination for licensure, a much, smaller subset that, currently have some of those requirements for ongoing licensure. Particularly with this change, do you see that potentially creating more movement on the emphasis on those quality requirements for continued licensure for EMT and EMS?
Yeah, I do. I mean, one of our areas of focus at the National Registry, and I referenced really the strength of the core, but I didn't mention this part of it, is on our value and branding. And as it relates to value, what is the value of our certification? More importantly, as it pertains to NCCP, what is the value for continued competency? So as we look and think differently about continued competency, we believe and are strongly convinced that the value of our continued competency program and of our certification will increase. And as I said early on, we are a nonprofit, a 501c3, and as such, we relieve the burden of government as a nonprofit. So our hope is that as we improve the value, the quality of our continued competency program, more states will want to require continued competency. And also not just the state regulators that require it, but the employers will want their paramedics and EMTs to maintain their national certification. And the EMS clinician themselves, we want all of the EMS clinicians, all the 500,000 that are currently nationally certified, maintain their national certification. And we have that trusted partnership with them, the EMS clinicians, the medical directors, the employers, and the regulators throughout their entire professional journey and career.
No, I think you definitely have that a unique vantage point with your organization in that, to your point, a lot of other professions, we as the public, as consumers, as it were, do get a lot of choice, but without that element, it makes driving home the value of certification and continuing certification certainly a different and more difficult dynamic. So wonderful to see these moves, and again, hopefully appreciated not only within our community but also the public. I'm just curious, having spent time at Intellios and now at NREMT, Bill, we have seen this major trend in testing, moving from more traditional assessment mechanisms and modalities toward a lot of emphasis on competency modeling, competency-based assessments. And of course, I think no vertical has been more pronounced in this space than healthcare. So how have you seen that trend, evolve through these two organizational experiences, as well as its impact on the way in which healthcare professionals serve the public?
Yeah, and there's that, starting with the last part there's that trust that the public has, certainly in their healthcare providers, but also including EMS clinicians as part of that. And EMS clinicians encounter patients often in their worst day of their life, sometimes their last day of their life, and it's that trust that we have that necessitates us to think differently about how we're assessing competence, and to ensure that we have a solid, valid, reliable, psychometrically sound, legally defensible, but yet fair examination to measure competency and ensure that our exams are measuring what they're designed and intended to measure, and furthermore, that we are ensuring the public safety by saying that if they're nationally certified, they are competent. So I think the public really has that expectation of healthcare. So that's why I think it's this evolution and this role that with focus on competence or continued competency is quite natural, and it's exciting to be a part of it as we see this kind of evolution in how we assess competency and how we ensure continued competency throughout the clinicians' careers.
Well, I think well stated, and certainly I know your colleagues in a lot of other healthcare credentialing organizations would reflect those thoughts. Bill, as you move from the end of this year as an organization, from strengthening the core with all of this transformational change To the extent to which you can share, of course, where are you going next? What else is on the horizon for NREMT?
So after strengthening the core this year, we're going to continue that focus on continued competency, which I alluded to earlier. We're also, as I stated earlier, we're used in all 50 states, and we have a very robust. We're a very robust certification organization. We're blessed with the resources we have that we can use to serve the EMS community. There are opportunities we feel that are out there internationally. So we are open to having conversations and have been in conversations with some areas and other certification organizations as well that we're going to be partnering with. And that partnership is important because it allows certainly us to use our strengths and the other organization to use their strengths in creating a synergistic effect. So opportunities for expansion is definitely on our horizon. Our board is a very strategically focused board and a very contemplative board. So they definitely like to make sure that they are doing their due diligence before we expand anywhere or do any new product offerings. And that's precisely what we're going to be doing is opportunities for expansion, a focus on continued competency, and continuing to embrace technology to help with our examination development process. Obviously, I can't believe where we've gone 21 minutes and haven't mentioned AI yet, but we will be looking at ways in which that can be embraced and utilized as part of a certification organization. So, and the last is going to be a heavy focus on that value that I was talking about earlier. So now that we've transformed the organization, we've strengthened our core, we need to bring greater value to the community that we're serving, which right now is certainly in the United States and the nation's EMS community. That's our main focus. But so that's a little peek behind the curtain in terms of coming attractions at the National Registry.
Well, I think we'll certainly look forward to seeing what else the future holds, and as those conversations move forward in terms of how you all can continue to create value for your credential holders and the public. The last thing I wanted to mention is just back to that value piece, Bill.
Mm-hmm.
I mean, I remember very well conversations going back to, I think, the year of Hurricane Katrina, and you all having a conference in that location, and how your organization turned out hundreds and hundreds of practitioners and repurposed, in essence, what was going to be a professional conference for public service. And keeping in mind, especially with some of my colleagues here at Strasz who've just undergone some of the recent hurricanes, it just really always strikes me with your organization, not only the fact that you are, of course, a certifying body, but have that unique ability and which you all have leveraged to really provide that direct service and assistance in times of great need. And I'd be remiss if I talked to you without shining a spotlight on that.
Well, thank you. Yeah, that was predates my time, of course, but I'm very familiar with Hurricane Katrina and what happened. And my predecessor, Bill Brown, who was the second executive director for our organization, was in New Orleans when the hurricane hit. Ironically, some of the staff, in fact, my chief operating officer at the National Registry, Alan Arguello, is from there and was down there during the hurricane. He was a paramedic there before he got into testing, before he was bit by the testing and certification bug. But he was responding and actively engaged down there, as were several other staff members who are from New Orleans now working at the National Registry. And one other thing that I did not mention is we are a 100% remote organization now too. Mm-hmm. So the beauty of being a remote organization, we have employees. Our employees are in 23 different states across the country. So that's one thing that's also exciting. But as they live in their communities, some of whom are still active EMS clinicians and still functioning. I'm still nationally certified, but I haven't touched a patient in about 10 years, and I'm okay with that because, like I said, I'm still working in EMS circles, and as I said, my other passion, working the testing certification circles.
Well, on behalf of individuals in the public like myself, our thanks goes out to all of the individuals that you all serve in their role in the front lines, and having seen some of them in action in my own life, and certainly I know we've all seen them in action in an ample way with some of the natural disasters we've had over the last couple of months. I know that that audience deserves our deep thanks. And that said, too, thank you, Bill, for you spending time with me today, for our conversation, getting to shine a spotlight on a lot of the great evolutions that you're doing there at NREMT. And I know myself and a number of others in the industry will continue to watch and wait for continued evolutions as you all take this forward.
Well, thanks, Rory, for the opportunity to chat with you. And I will be remiss if I don't tell people to go to our website and find out more at nremt.org.
Well, thank you very much. I do encourage everyone to visit. And for those who watched our episode today, greatly appreciate all of you spending time with us. I look forward to speaking with you again in about 2 weeks on our next episode.